of the climate crisis. This quotation by Dr. Renee Salas, who is an ER physician in Boston, could not be more true. As clinicians, whether we recognize it or not, we're often the ones seeing the effects of the climate crisis in our patients, whether it is patients enduring longer allergy symptoms due to lengthening of the freeze-free season, or young, healthy patients showing up with acute kidney failure during summer heat waves, or seeing increased rates of mental health concerns in the wake of intensified natural disasters, similar to the wildfires that we have all been bared witness to on the West Coast. These patients are all real-life examples of the climate crisis, and as clinicians, we are the ones that are seeing them and need to raise awareness of this issue. So the impacts of climate change on human health. This is a little bit busy diagram from the CDC, but I do think it does a really nice job of showing a lot of the different health concerns of the climate crisis. So the heat-related illnesses, forced migration, malnutrition, water issues, respiratory symptoms, malaria, dengue, obviously infectious disease is a huge part of this. So there is a lot to consider when considering the health impacts of the climate crisis. For the purposes of this talk, I'm going to focus mainly on air pollution and some of the respiratory concerns and cardiovascular concerns associated with air pollution. And then of course, because I'm an ear, nose, and throat surgeon, I am going to take my first moment to talk about climate change and allergies. And a part of that is because I think a lot of people hear about some of the health impacts of the climate crisis, such as mental health disease, allergies getting worse, but you're not always sure exactly why. So I want to take a moment to explain for this particular example why climate change is making allergies worse. So there are three main reasons that climate change is making seasonal environmental allergies worse. The first is the longer pollen season. So in general, the freeze-free season, which is the season absence from freeze when plants are allowed to grow, is getting longer. So this schematic shows the increased number of days where the freeze-free season is happening. And so basically it's a number of days where the plants can continue to grow and produce pollen. So as you can see, the number of days is getting greater. And it may not seem like a large number of days, you know, when we're talking about 5 days or 10 days, but if you're a patient suffering from seasonal allergies, a week or two makes a huge difference. The second reason that climate change is making seasonal allergies worse is increased production and potency of pollen. So studies have shown that in the setting of increased temperature, increased humidity, and increased CO2, plants are producing more pollen, and obviously the CO2 is due to increased photosynthesis, which allows plants to grow more and produce more pollen. But studies have also found that the pollen itself is more allergenic, meaning it's more potent, and so symptoms can be more severe. The last one is the introduction of new allergen-producing plant species. So this is a similar idea of Lyme disease being seen in previous areas that we did not see Lyme disease. And it's due to global warming, which affects the migration of the mosquitoes. And so similarly, introduction of new allergen-producing plant species, as the temperature is changing and as humidity is changing, plants are sprouting up in new areas that they didn't otherwise inhabit, and therefore producing pollen in areas that otherwise would have been free of those plants and of those pollens. So we're going to move next to heat and health. And, you know, I really want to spend a moment because I do think that, you know, global warming is talked about a lot, but heat itself is one of the top killers among all types of weather hazards, including hurricanes and tornadoes. So this schematic on the right shows from the 1960s to the 2010s how the average number of heat waves has increased and the heat wave season length has increased across the United States. So again, this is a little bit busy slide, but really at the top, I wanted to point out some of the most vulnerable populations to the impacts of heat on their health. So this, of course, is the less abled and the pregnant women. It also includes people of a lower socioeconomic status, such as poor, displaced, and the homeless. It includes, in general, our most vulnerable populations that we see in our clinics, which are oftentimes children and the elderly. And it includes those that just spend a lot of time outdoors, which includes athletes and outdoor and manual workers. So rapid rises in heat gain due to exposure to hotter than average conditions compromise our body's ability to regulate temperatures and can result in a cascade of illnesses which are outlined below. And you can see there are both direct and indirect impacts. Some of the direct impacts include heat cramps, heat exhaustion, heat stroke, and hyperthermia. Deaths and hospitalizations from heat can occur extremely rapidly the same day or have a lagged effect several days later and result in accelerating death or illness in an already frail population, particularly observed in the first days of a heat wave. Temperature extremes, as we've all seen as clinicians, can also worsen chronic conditions, including cardiovascular disease, diabetes, and cerebrovascular disease. Heat also has important indirect impacts as seen on the left side of this schematic. So it can alter human behavior, the transmission of diseases, health service delivery. This was a big one with the wildfires when hospitals and clinics had to close down because of the wildfires themselves. We see this a lot with hurricanes and tornadoes also. Obviously, heat affects air quality and it can really affect our critical social infrastructure of energy and transportation and water quality. So the increase in wildfires has been shown across the US, especially on the West Coast. Research shows that changes in climate that creates warmer, drier conditions and increased drought cause a longer fire season, and these are boosting and causing increases in the wildfire risk. And is one of the reasons why so many news headlines have said climate change has led to worsening wildfires. And it may only be one of the factors that is causing these worsening wildfires, but it is definitely a very important one and one that we need to consider moving forward. So as we talk about wildfires, I want to take a step back and just talk a little bit about cleaner air. We may have remembered the headline a few weeks ago where the smoke or the air quality in California, the wildfire smoke had traveled here to DC. This affects the quality of our air. And it's really important to think about the health benefits of cleaner air. This is a great year to do so. We're at the 50-year anniversary of the Clean Air Act, which was implemented in 1970. So emissions of major pollutants were reduced by 73% between 1990 and 2015. So yes, our air is definitely cleaner now than it was 50 years ago. The EPA determined that 230,000 deaths in 2020 were avoided per year due to lower concentrations of outdoor particulate matter. In addition, other benefits include reductions in asthma exacerbations, reductions in acute myocardial infarctions, and avoided hospital admissions for respiratory conditions. The economic benefits of cleaner air are valued at $2 trillion in 2020. So particulate matter is one of the most important aspects of cleaner air. So in general, when we talk about air pollution, that doesn't just include particulate matter. It includes nitrogen dioxide and sulfur dioxide and many other particles. But particulate matter is a really important one to discuss, especially when discussing health. And particulate matter, as we'll see on the next slide, is subdivided into different sizes, such as PM10 and PM2.5 and ultrafine particulate matter. There's a lot of different sources of this particulate matter. So obviously we see forest fires, we see cars and trucks, unpaved roads, factories, and construction and demolition. And while the composition of wildfire-generated PM2.5 may be a little bit different from PM2.5 from other sources, it still affects our health. And in general, all of these sources of particulate matter affect our health in very serious and concerning ways. So as I mentioned, the size of the particulate matter is really important when we think about health. So if you look at the schematic, PM10 is particles that are less than 10 microns. A human hair is usually about 50 to 70 microns. And PM2.5 are those particles that are less than 2.5 microns. Ultrafine particles are ones that are less than 0.1 microns. And when we talk about these size, we also think about where these particles deposit. So usually PM10 deposits more in the upper airways, and the PM2.5 and the ultrafine particles the PM less than 0.1 microns are the ones that make their way down to the lower airway and potentially even into the bloodstream. So next, I'm going to take a moment to talk about two different processes, respiratory disease and then cardiovascular disease and PM 2.5. And the reason I want to do this is, again, we hear a lot about all these disease processes that are associated with air pollution and poor air quality, but I think it's really important to understand why. So respiratory diseases, chronic obstructive pulmonary diseases such as asthma, and chronic exposure to air pollution can increase the risk of lung cancer. And so the gamut is really wide, from acute inflammatory diseases to lung cancer in association with air pollution. So there's two main mechanisms that respiratory disease is caused by PM 2.5. So the first one is just oxidative stress. So the oxidative damage is really associated with the primary development of asthma and other chronic obstructive pulmonary diseases. And the second one's inflammation. So this could be acute inflammation, airway hyperresponsiveness, and that can lead to an increased inflammatory cytokine release and reactive oxygen species, which causes this sort of acute, again, hyperresponsiveness secondary to that inflammation. And the second one is chronic airway remodeling. So obviously that's more associated with the increased risk of lung cancer just from chronic exposure to these particulate matters that we're breathing in. And then cardiovascular disease and PM 2.5. So there's a lot of increased heart disease associated with PM 2.5 exposure and ultrafine particle exposure. This includes myocardial infarctions, arrhythmias, hypertensions, a lot of different things. And there are two main mechanisms associated with cardiovascular disease and particulate matter exposure. And again, on this slide, I only wrote PM 2.5, but this also includes ultrafine particles. And it's actually more the ultrafine particles that lead to the cardiovascular disease, because these particles are so small, they can cross the lung-blood barrier and get into the bloodstream. And once they get into the bloodstream, they cause inflammation and local oxidative stress. That's something we heard about with respiratory disease, the oxidative stress. And similarly, when these particles enter the bloodstream, we see this similar sort of stress and inflammatory response. That can lead to atherosclerotic instability and increase the risk of thrombus formation. The indirect effect is similar to the respiratory mechanism also, where you have increased systemic inflammation, and that also can lead to atherosclerosis progression, endothelial dysfunction, and increased blood coagulability, which again leads to all of those downstream cardiac effects, including increased risk of MIs, arrhythmias, and hypertension. So next, I'm going to go through a few different studies that have really sort of shown how impactful particulate matter is, and in general air pollution is, on health. So this is a study from the New England Journal of Medicine, and it evaluates the associations of inhalable particulate matter with an aerodynamic diameter of 10 microns or less, and fine particulate matter with an aerodynamic diameter of 2.5 microns, with daily all-cause cardiovascular and respiratory mortality across multiple countries and regions. So they looked at over 600 cities, and notably most of these were in the Northern Hemisphere. But what they showed was an independent association between short-term exposure to PM10 and PM 2.5 and daily all-cause cardiovascular and daily all-cause respiratory mortality in these 600 cities across the globe. I'm going to talk a little bit about some of the vulnerable populations that we oftentimes see in our clinics. So these next two studies are going to be about children. So this is a prospective study, again, from the New England Journal of Medicine, that looked at over 1,700 children in 12 Southern California communities. Their lung function was measured annually for 8 years. Results of the study demonstrate that the current levels of air pollution had a chronic adverse effect on the lung development in these children from ages 10 to 18 years. So really important, years of their life in terms of lung development. And basically they showed deficits in the growth of FEV1 when they were exposed to different particulate matter and different particles in air pollution, including nitrogen dioxide. So this next study about children is one that is from the Environment International. So asthma is one of the most common chronic illnesses of childhood, and it affects over 6 million US children. So this review paper looked at 41 different studies. And results from this meta-analysis indicate a statistically significant association of exposure to black carbon, nitrogen dioxide, PM2.5, and PM10, and the risk of asthma development in these children. So moving on to another vulnerable population is pregnancy, pregnant women. You may have seen the study. It was highlighted in the New York Times a few months ago. But basically, this is a really large systematic review that showed exposure to PM2.5, that showed that exposure to PM2.5 or ozone was associated with increased risk of preterm birth in 80% of the studies and with low birth weight in 86% of the studies. It also showed that populations highest at risk were persons with asthma, so other comorbidities, and minority groups, especially Black mothers. I also want to talk for a moment about marginalized communities, and so we're going to talk a little bit both about communities of color and those of a lower socioeconomic status. So this is the last study, and it was published in June 2017, again by the New England Journal of Medicine, and it studied the Medicare population from 2000 to 2012. Basically, they evaluated the mortality rates related to annual exposure to PM 2.5. So what they found was that in general, so you'll see here, the Hispanic and Asian populations had an increased risk of morbidity or mortality associated with PM 2.5 exposure as compared to white Americans. But what's most concerning is when you look at the Black Americans, their increased risk of mortality was 3 times as high as the overall population. So basically, they found that minorities, in this specific instance, Hispanics, Asians, and Blacks, had a higher risk of death in association with PM 2.5 exposure, with Black Americans having that 3 times higher exposure or higher risk as compared to the overall population. And then, of course, just to talk about the socioeconomic status, those eligible for Medicaid, so in general, those of a lower socioeconomic status also had a higher risk of death as compared to the population overall. So I always want to end on a positive note. So does cleaner air equal better health? So this is one of my favorite studies, and basically this is a study out of JAMA. It's a longitudinal study looking at over 4,100 children in Southern California. And so over this 10-year period, they looked at 2 really important aspects of air pollution, including nitrogen dioxide at the top and PM 2.5. So what these graphics are showing is that over this 10-year period, the air was cleaner. So as you can see, the general decline down shows how these levels of, again, NO2 and PM 2.5 respectively went down. And the different colors just refer to different regions and different populations. During this time period, asthma incidence also went down. So basically, at the top, a decline in nitrogen dioxide was significantly associated with lower childhood asthma incidence. And on the bottom, a decline in PM 2.5 was also significantly associated with lower childhood asthma incidence. So yes, cleaner air does lead to better health. In this case, fewer children diagnosed with asthma. And on this slide, what is the role of the healthcare professional in all of this? So I am obviously a huge climate and health advocate, and I devote a lot of my time and energy to talking about this with friends, with colleagues, with patients. And I really think that as awareness of this issue grows, healthcare professionals need to take more of a stand on this issue, both in terms of mitigation and adaptation, both for our health, for the health of our patients, and just for the future. So mitigation, become an advocate. Being an advocate is great. Really talking about a subject that you're very passionate about is really important. And I think, again, as that first slide showed, humans are the faces of the climate crisis. We are oftentimes the ones seeing these patients in our clinic. And so we have increased awareness, and we are the ones that really need to spread the knowledge that humans' health is being affected by the climate crisis. Also promoting sustainability practices in healthcare settings. So again, we have a voice oftentimes in the healthcare settings that we work with. And so I think encouraging and promoting sustainability practices, and I'll kind of leave this to Dr. Malik for what she's going to say about sustainability, but that's really important to have a voice for that. And then also teaching patients about climate change. Climate change doesn't have to be political. It doesn't have to be polarizing. As long as you frame the information that you are talking to patients about in the setting of health, I think it can overall actually be very well received. And again, we're not trying to, make anyone defensive. We're not trying to talk about things that are controversial, but the data is very clear in terms of the way that climate change is affecting health. And I think that our patients deserve to know about this, and we can be the ones that share this knowledge, again, in ways that if we talk about it just in sort of the health framework, then it is usually well received. I will say I have not had any patient problems when talking about this, but I do understand that in certain areas, you might have a little bit more resistance to it. But again, if you just talk about it in the framework of health, I do think that it's a really important topic and one that has overall been pretty well received. And then adaptation. So teaching vulnerable populations about coping with heat or natural disasters, that's really important. So obviously as an ENT, I sometimes will talk to my patients about how their allergies may be getting worse because of climate change, that they may want to continue their allergy medications for longer, or that we might have to up the dose some just because they might be having more symptoms from their allergies due to the impacts of climate change. And obviously ensuring patients have adequate disaster preparedness plans in place. So this is really important as we see more natural disasters intensified by climate change. Again, over the past 6 weeks, it's been wildfires and hurricanes. It seems like every other day we're hearing more news headlines about these. And so really just sort of being that voice for patients that helps them prepare for these worsening natural disasters that are fueled by the impacts of climate change. So that's all I've got for now. Please feel free to reach out to me on Twitter. I'm also on Instagram. Again, this is a subject that I'm incredibly passionate about and would love to talk to anyone who's interested in it, who wants to talk to their patients more about it, or who just wants more information themselves. If anyone is interested in becoming an advocate on this, please feel free to reach out. I've got a ton of great resources and can connect you to some really great organizations that have helped me become a more well-informed advocate. So I'm going to stop there, and I'm going to hand it over to Dr. Malik, and we'll go from there. Thank you all.
Perfect, Dr. Tumala. That was incredibly informative, and your passion for this subject is, it shines through. I am passionate about this as well, but on a sort of a global level, although I guess when we're talking about climate change, it's all global. But really, I want to talk about how we as healthcare providers have a direct impact through our industry and then sustainable living. So I'm going to be sharing some slides as well. You'll just give me a moment to get this set up. Okay, so I'm going to be talking about climate change, healthcare, and sustainable living. And again, I'm a breast imaging radiologist here in DC. So as a breast imaging radiologist, cancer health and cancer detection and prevention are incredibly important to me. And climate change does, in fact, affect our cancer risk. It also affects outcomes. So how is that? Through exposure to carcinogens. So some examples, aflatoxin are mycotoxins created by fungi, and they are produced in warmer climates. And so they've affected food crops in some of the warmer climates, but with the rising temperatures, they're actually starting to affect more temperate climates as well. These are known to cause liver cancer. They can start having an effect at a very young age, and are affecting the food supply in what could soon be a global fashion, and something to really be mindful of, because they're affecting staple crops like peanuts, like maize, things that really are important to so many already disenfranchised communities, and again, affected directly by climate change. Particulates in the air that obviously Dr. Tumala has so eloquently discussed. could be causing that chronic lung damage and inflammation that can go on to lead to cancer. And then, when you think of floods, you don't think of cancer. But for example, Hurricane Harvey, when it had the disastrous and devastating floods to the city of Houston, actually caused flooding that affected oil refineries, Superfund sites, and chemical plants. And those chemicals were released, some which are incredibly potent and have long half-lives, like dioxin with a half-life of 50 years. And so those carcinogens will affect that population, not just from, at the time of the flooding, but for years to come. And so it's incredibly important to be mindful that, not to say that what Dr. Tumala discussed is obvious, but again, we see a fire, we think of our lungs, we see flooding, we think of our homes, but climate change has these more deleterious effects that can be long-lasting and not manifest until later. And so it's important to be mindful of them. And then also, as she referenced, the access to care is impacted. So, again, you can think of direct impact, whether it's the fires and people not being able to get to the hospital, or the floods and people not being able to get to the hospital. But for example, when Hurricane Maria hit Puerto Rico, a large part of the supply chain was affected because intravenous fluids were produced in a plant on the island of Puerto Rico. And so it didn't just affect the Puerto Rican residents, it actually affected people around the country. So again, for me, cancer patients were affected. People who need infusions, inpatients, outpatients. It actually affected my ability to do breast biopsies. And so when we're limiting our access to care, we're affecting outcomes. The pandemic, while it's not necessarily thought of as climate change, we know that these zoonotic infections can increase during times of with climate change. And so many of my patients lost access to mammograms, lost access to biopsies, lost access to the exact kind of cancer care that they might have wanted or needed. So we just really have to be mindful of the effects of climate change when it comes to cancer. Oh goodness. Okay. So the healthcare industry itself has is a major contributor to climate change. The industry is actually the second most energy intensive industry within the United States, contributing to 10% of the US carbon emissions. And where are those coming from? So for energy, operating rooms have ventilation for the rooms themselves. We're contributing to a sterile environment, as well as keeping equipment and surgeons and staff cool. Anesthetic gases can be 1,000 times more potent than carbon dioxide. And then you've got the pharmaceutical industry that is 50% more carbon intensive than the automotive industry. And so, taking a look at that, I think the healthcare industry should really start thinking of more renewable energy sources, consider generating it on site, whether that's geothermal or other renewable energy sources. Of course, working on being more energy efficient and finding ways to improve the heating and ventilation. I work in a radiology facility, and we have a ton of equipment that we have to keep cool all the time. We can't afford to, turn off the AC or use energy saving in that fashion. And so we need to really be examining ways to provide that optimal cooling while also conserving heat or conserving energy, because again, this is such a large expenditure. So pharmaceuticals, I already referenced that it was 50% more carbon intensive than automotive. Some of that is through the R&D, the research and development in creating the pharmaceuticals. Some of that is in transport of pharmaceuticals. Some of that is in, the marketing and sales of pharmaceuticals themselves. And then we know that some of these agents, again, I referenced that use for anesthesia or for chemotherapy or for immunotherapy can have a particularly large impact imprint rather. So for as large an industry as pharmaceuticals is, I think it's really important to hold them accountable for their carbon footprint, have them prioritize low emission pharmaceuticals, change the way that they are moving forward in their industry, whether it's changing their transport of pharmaceuticals, changing the way that they're marketing, and then again, pay for their carbon offsetting to try to at least mitigate some of their carbon emissions. So medical devices, much in the same way, are using a lot of resources. Again, for me in radiology, it's a really high energy place, whether it's the equipment itself, whether it's the energy that's needed for it. And, I think with the way that the healthcare industry is, we think of everything as single use. We think of everything needing to be sterile, and we don't think about the concept of reusing or recycling or reducing. That's just not the mindset that we have within the practice of medicine. And I think that that's an approach that we need to start taking, because the resources that we're using for each device, for imaging, for storage capacity of imaging, for care, it's really starting to take a toll. So we need to make energy efficient medical devices, whether that's the imaging itself, the devices that patients are using, monitors at home, things of that nature, and then promote sustainable manufacturing. So food. So you don't think of that when you're thinking about healthcare. We think about how it impacts our health, but we don't think about the fact that every hospital and many of the large clinics have cafeterias that are serving food to thousands upon thousands of patients and people daily. And the amount of waste that goes into that, as well as the amount of energy that it takes to produce and deliver that food. And many of those are using animal products quite heavily, despite the fact that they are in hospitals. In fact, not now, but when I was in residency at the University of Texas Southwestern, we still had a McDonald's in the hospital, which I should hope these days is unheard of, but nevertheless, that was the highest grossing McDonald's in North America. And, the use of animal products was a huge problem, contributing to the health of our, or lack thereof, of our patients. So I think hospital systems really examining how they are producing and delivering that food. So I have seen a lot of hospital systems where, rather than just delivering trays without thought to every patient in the hospital, they're now having more of a room service type system where patients can order off a select menu at a time that they're choosing, and food of their choosing, so that you have less of those Jello bowls sitting around, or those unknown meat trays sitting around. The use of local and sustainably grown food. So again, transport contributes a lot to the greenhouse gases. And we know that food that is produced locally and sustainably is going to have lower carbon emissions. And then reducing the overall food waste. So again, mentioning the way that they could use a menu system, as well as help hospitals and the healthcare industry implement ways to compost or utilize that food waste, and reduce the reliance on animal products. There are a lot of hospital systems, particularly I know in New York, where they're trying to move towards more plant-based options, but really I think we should be moving away from the utilization of animal products, just based on, we know that they are healthier and have better outcomes, but also, the hospital isn't like a 5-star dining experience, nor does it need to be. It's about providing nutrition and sustenance for the patients that we're serving. And so I think that we could be really re-examining the menus that we're providing in those scenarios. So transport, I've mentioned it in a couple different fashions, whether that's for patients and personnel, or the shipment of equipment, supplies, and pharmaceuticals. So we really need to take a look. Number one, most hospitals do tend to be in an area that can be reached by public transport, but really, making sure that that is central and imperative and important to the city planners. So both personnel and patients would benefit from being able to access their healthcare through public transit in ways that wouldn't involve adding to the cars in the parking garage and the stress of commuting and travel. Consolidate appointments. So for me, for example, within cancer care, patients are going to have a lot of appointments when it comes to their surgeon, their oncologist, their radiation oncologist, maybe the plastic surgeon, maybe the genetic counselor. And so having, cancer centers and multi-specialty centers that are able to consolidate those appointments so that both for the convenience of the patient, but really, when you think about it for climate change too, consolidating those appointments to a single visit, a single day, where you're able to minimize the transport back and forth. And then telehealth, which I think, pre-pandemic isn't necessarily something that played a huge role in all of our lives, but we've all been forced into it for better or worse, and really, I think, for better, particularly when it does come to climate change, because, of course, you're reducing the amount of greenhouse gases that are emitted, and, saving the trip for both patient and provider. So I think that'll do great things for climate change. And then procurement and supply chain. So kind of already referenced this with transport, but optimize the way that we are transporting supplies. But also, I think another issue that the pandemic has highlighted is that the supplies and the raw materials that are needed to make personal protective equipment and a lot of medical supplies are a problem. Whether it was a specialized polymer or plastics that go into the gowns or the N95s or things like that. So, I think that it would, the onus is really on us to be examining ways that we can produce that same level of equipment, whether it's something that has the filtration capacity of an N95 or the protective capacity of a gown that blocks liquids or aerosols, so that, but also can be produced more sustainably. And then again, if these supply companies aren't able to find ways to do that, to at least encourage them to offset their carbon emissions or pay for them. And then waste. So whether it's medical waste or food waste, we thought that we were doing a great thing with the EMRs, eliminating paper charts, but we're so wasteful in medicine. And again, some of that is the whole, everything needs to be sterile concept. Everything is packaged in plastic, and everything is thrown out. And I mean, I see so much waste throughout the day for things that, even now with the constant sterilization and sanitization, we're sanitizing things that, you could also just, not touch it with your hands, or you could, wash your own hands afterwards, or the waste with the wipes and the supplies that we have within medicine is something that I think that we could really carefully consider how useful each of those practices are and see a way to optimize them. So with that, that's what we are doing and could do better as an industry. So what can we be doing on a more individual level, which is really something that I'm passionate about. Eco-friendly living has been a part of my life since I can remember. And, it's something that I think we all need to be taking on. And the number one thing that we could be doing really is plant-based diet. So a plant-based or a plant predominant diet, because 25% of carbon emissions are from the food industry, and 50%, of those emissions are from animal products. And when it comes to the food industry, and particularly reliance on animal products, it's not just about carbon emissions. It's about the loss of biodiversity, deforestation, which again further contributes to climate change by not being able to offset carbon emissions, and freshwater and land use, which has an impact on communities as well as biodiversity, and then the pollutants that affect our fresh water. So just as an example, the carbon cost of beef is 20 times greater than that of beans. And oftentimes the argument will be in regards to the water use for things like legumes or nuts and seeds. And that while that is true, animal products overall still have both higher carbon and water use, or carbon production and water use. And so plant-based diets overall do optimize both. I read a statistic that I thought was really interesting, that if everyone went vegan, we could save 8 billion tons of carbon dioxide, not only through the elimination of the consumption of animal-based products, but also because land that was currently being used for livestock could then be repopulated with trees that could offset our carbon emissions. And then with plant-based diets, in addition to the direct health benefits from whether it's the inflammation, the heart disease and diabetes, again, having this indirect health benefit by reducing carbon emissions and helping mitigate climate change is really important. So transportation, I already referenced it a little bit when I was talking about the healthcare industry, but we as human beings are also contributing to it. It's again, about 1/4 of the United States greenhouse gas emissions are from those of us that are getting around and most often getting to work. So what's a way that we can impact that? Well, the easy answer is to walk or bike. They have obvious health benefits. They aren't going to have any emissions, it's a great way to get to and from work. Can often be de-stressing, and again, better for your mental and physical health. But we know that that's not always an option. Not everyone lives within walking or biking distance to work, particularly in a place like the DMV, right? Mass transit, of course, reduces the number of cars on the road. You're also supporting your local economy. And, I personally like it because I get to sit and, read a book or scroll through the news. But again, not always an option based on where you're living. And hopefully metropolitan areas will continue to optimize their mass transit options to get cars off the road. You can always carpool, use those HOV lanes. And I think it's important for cities to be incentivizing all of the above. And then electric or hybrid cars. The good thing is that there are more and more resources when it comes to the charging stations for electric vehicles, and just so many more options. It's not just, the $90,000 Tesla anymore. There are more options on the market, and consumers are, I think, really benefiting from those. And then working from home. So again, we might not have ever thought of telehealth, and a lot of us might not have ever thought of working from home, but the pandemic has sort of forced that for so many people. And I read another interesting statistic that Goldman Sachs said that virtual meetings could decrease oil demand by 2 to 3 million barrels per day. So think if we had this live, there would be people coming from hospitals all over DC, private practices all over DC, possibly even some from Virginia and Maryland. And instead we're able to gather here, whether live or those who might be viewing this on YouTube later. And I know for me, it's really made things great. I don't have to rush to a meeting after work, but also just thinking about the benefits to the climate and my health. And in fact, because of the pandemic-related lockdowns, by June, we had a 5.5% reduction in the 2020 emissions. I don't know what the status is now as those lockdowns and restrictions have been eased. I can say anecdotally, as someone who does on occasion have to commute by a car, that the traffic is certainly less, and I hope never to see it go to pre-pandemic levels, but let's see where time will take us. But I do think that the work from home model has worked well for a lot of people, and hope that that will be something that will continue to be implemented, both for convenience, for employee satisfaction, and then for things like climate change. So food waste, I reference it again with the hospitals. 30% of food is wasted and 10% of carbon emissions are from food waste. And, I just don't think it's something that we're thinking about in our minds. When we throw away food, we think of things being biodegradable, but we don't think of what happens when something biodegrades. So biodegradable does not mean good for the planet. Biodegradable just means it won't be in that landfill forever. But the gases that are produced, again, from food waste are harmful to the environment. And so reducing food waste is incredibly important. So number one, don't waste food. Don't buy food that you will waste. Meal prepping and planning can reduce your food waste, can honestly reduce your food cost, and improve your health when you're planning healthy menus and forcing yourself to, take your own lunch and avoid buying something from outside. And the other benefit there for the environment is you're not, buying that takeout lunch that comes in whatever kind of packaging. Composting. So, I think maybe 5 or 10 years ago, if you said composting, people would think of like fruit flies and worms and rotting and decaying food. And that's not what composting has to be. So here in the DMV, for example, we have a lot of great community resources for, compost drop-off. So a lot of the farmers markets in the region, places like Mom's or Whole Foods, and then of course, paid services are all available in the DMV. I've been walking it to my local farmers market for the last 4 years, just storing food scraps in a container. You can even put the container in the freezer if you're really worried about, fruit flies or things like that. Of course, you can be doing it at home in your own bin and garden if you are afforded the space to do that, and it's a wonderful option. And then being more mindful. We all overbuy at times, or something happens and a work meeting comes up and you're served lunch there, and so you don't eat your lunch, something like that. So when that happens, just be able to react and have a plan, whether it's freezing your leftovers, making a juice, making a stew that you'll eat later. Just try not to waste food. And if you are left with a, decaying apple in your fridge, at least try to compost it. So go green. If you hear that, I would have to guess, if I, unmuted everyone and asked what the first thing that you would do, it would probably be to say, oh, I recycle. And the thing is, if you look at those 3 triangles that are on the bottom that we've all seen, they actually mean to reduce, reuse, and then recycle. So the first 2 are what we should really be doing first in that continuum. Even though recycling is great, 1/3 of the recycling in this country is sent abroad. In 2018, China actually banned, and several countries upped their standards when it came to accepting the United States recycling. And when I say up their standards, so when we recycle or when we put things into a recycling bin, not all things are recyclable. So not everything that has that little arrow, trio of arrows on the bottom is actually recyclable plastic. They just kind of put the arrows and slap a number 1 or a number 5 or a number 6. And not all jurisdictions take all materials, and not all materials are recyclable baseline. The other thing is the contaminants when it comes to, needing to clean what we recycle. So, used to people would accept whatever you put in the recycling bin, but that's not the case anymore. If you're sending in dirty plastic, they're not willing to accept it. And again, things that are unrecyclable, those utensils often aren't recyclable. So if people think, oh, well, I recycle my plastic utensils. Well, that's not actually doing anything. Coffee lined cups, they have a wax lining that's fluid resistant. It also means that they can't be recycled. So really the most important thing you can be doing when it comes to the Go Green is to eliminate your utilization of plastic. Or minimize it as much as possible. Go plastic and package free. So one easy way, and it's so easy, is just to buy a reusable water bottle and then use your reusable water bottle, right? So a lot of people have them, never take it with them, and end up with a water bottle, or they have their water bottle and they don't think to say, can I refill this, or is there somewhere I can refill this? I have mine with me all the time. I refill it at the airport, when I'm at the park. Even when you go to a gas station, they most often won't mind if you fill it with hot water, or fill it with if there's a water spigot or spout on the soda machine. So it's just so easy, and the amount of petroleum or oil that you are eliminating, or the utilization. 1 year's supply of water bottles for globally could fuel 1.3 million cars. It's 17 million barrels of oil and 2.5 million tons of carbon. So it's clearly a problem that we need to eliminate, that could have a huge impact on climate change. And the other thing, again, not just plastic water bottles, of course, it's all the plastic packaging. We live in this like Costco world where we feel like we need everything individually wrapped. And maybe if you're supplying the snacks for a soccer tournament, that's true. But for the average person, if you just buy a good lunchbox and put things in small amounts, you have your individually wrapped snacks right there. So making a better plan for when it comes to individual portion sizes, or buying package free. I buy in bulk here in this area. Mom's, Yes Organic, Whole Foods. All these places have an option to buy grains, beans, nuts, seeds, and more in bulk, and avoid all that packaging. So what are our goals? Reduce carbon emissions, and with so many of the ways, both in our industry and personally in our own lives. But really, more than anything, to be aware and hold ourselves accountable. A lot of what we do as consumers and as physicians is about making our lives easy and convenient. And sometimes that convenience ends up affecting the earth. It might be helpful to us, but not, to our planet. And I think that it's a vicious cycle that's going to come back and bite us. So, we need to be more conscious about our actions, and we need to make the healthcare industry about health. That includes what we're doing in regards to climate change. So, with that, Dr. Tamala, if you want to rejoin. And yeah, so I haven't seen any questions in the chat. Are there any questions? I think if you want to type in the chat, that would be best. But if you do want to ask your question, if you feel like it's maybe a lengthy one, we have time for a couple of questions. Dr. Tamala, do you have any of your own input on the healthcare industry or sustainable living while we're waiting for some questions? And if you want to unmute.
No, I think I really liked what you said about, it's not just buying the water bottle, it's using the water bottle, right? Like it's so easy to buy all these things. But actually, one of my favorite holiday gifts that someone gave me, and she's an environmental reporter, which I guess kind of makes sense, but she gave me one of the reusable forks. And initially I just had it in my drawer, and now I actually keep it in my work bag. And it's actually crazy how much I use it, because I keep it in my work bag, and it's just very easy to wash as soon as I use it. Right. But really, it's like buying these things and then using them, because that really is just how you eliminate waste. And I think the other thing is, it might seem like these things are nuances, or not nuances, that they're a little bit like annoying things that you have to do. But once they start to become a lifestyle, then that's it. They're a lifestyle change, and they really do make a really big impact. And so I think that we all have to acknowledge that approaching climate change is going to be a lifestyle change. We're not all going to be sitting, in our pretty little lifestyles, doing whatever we want to do and have climate change be fixed. No, it's going to require change from all of us, but that doesn't mean that change has to be painful or hard. It just means that just a little bit of change.
I 100% agree. And, I think we need to think about it like, we all know we need to exercise for health, for our health. We know we need to eat healthy. We can't just eat potato chips every day. What would be easy is probably grabbing a bag of potato chips and, a soda. I I can't imagine how that's easy, but whatever. I'm sure for some people that, that is what's available and that's what's easy and doesn't take time to prepare, but that's bad for our health. Sitting on the couch and being a couch potato is bad for our health. So we know those things and we've found a way to change them. And same for climate change. We've identified the things that need to happen and we just all need to be able to incorporate them into our lives. And I kind of what you said, this doesn't have to be like some profound change. It's just a matter of, I'm going to take my water bottle with me. Like I'm leaving the home. I mean, we all managed to start wearing masks, right? Like I don't leave the home without a mask. I have extra masks in my car. I have like 50 cloth masks that, were donated or my mother-in-law made or something. And 6 months ago, I didn't have any masks, right? So we can make changes. I think the pandemic has shown that we are capable of making change. We are capable of drastic changes. That the whole working from home thing. 6 months ago, if we had said, well, if everyone works from home, we'll eliminate climate change by 2050, everyone would have said that's crazy. Like I have to be at this meeting in person, and otherwise, this important deal won't go through. And I hope that we've disproven that. At least some of that crazy business travel where people like fly across the globe for 24 hours for a meeting. That definitely.
Even within healthcare, residency interviews are going to be virtual, which is just so great. I think that's a really important step, and it's pretty impressive how much emissions will be cut down. Sorry, Dr. Axelrod. Nice to see you.
Oh, hello. Yes, thank you for joining. If you want to, okay. So have you found any useful launch points or tips for engaging healthcare institutions on climate change to start change? Useful strategies to increase awareness or motivation to act? I have not. I am not in a healthcare system myself. I'm in outpatient radiology and definitely feel like medicine overall is a field that can oftentimes be resistant to change. But what about you, Dr. Tamala? You're obviously part of all these different organizations. Are you aware of any organizations that are trying to make moves in the healthcare space?
Yeah, so I think the really big one that's often talked about is Healthcare Without Harm. And they do have, so I think one, they'll try to give you some toolkits and like some input on how to address the healthcare sector. And if you, again, they have some like action plans set in place. I think Green Health's another one that's talked a lot within the healthcare sector in terms of them like doing sort of these like larger institutional changes. With VCCA, Virginia Clinicians for Climate Action, which is one of the organizations I'm a part of, I don't actually do this with them because I don't work at that hospital, but I know at the Inova Hospital, they'll try to do like certain initiatives. Like one of the ones that they did was to ban plastics in the cafeteria. Mm-hmm. And I really think that was like, it was kind of like a QI project, like, like how we all have to do in residency, where one of the members just started talking to like basically going up the chain and just picked one action step. And it was just eliminating plastics from the cafeteria. Another one I heard about this is somewhere in the Midwest, where basically the anesthesiologist just approach like the anesthetic gases, and that was like his one project having one specific action plan. I think that it really depends on whatever hospital system you're in terms of how receptive or not receptive they're going to be to these changes. Right. And I think it is from an individual standpoint, I think when we have a specific ask, we're more likely to have it followed through. But again, it's like any sort of QI project where you just have to kind of keep working yourself up the chain. But there's a couple of people at Healthcare Without Harm who I've reached out to before, and they do seem like they have some really good toolkits in place to help with that.
Yeah. Good question, Dr. Axelrod. Well, if there are no other questions, I think this was really informative for me. I hope it was informative for those of you who are here today. Obviously, reach out. I guess I did have one more slide. You can reach me at Anjali Malik MD on Instagram or Twitter, or through my website, anjalimalikmd.com. You can reach Dr. Tamala at Nilu Tamala, sorry, on Twitter and Instagram. And, certainly want to keep this dialogue going. It's incredibly important and imperative for us, our patients, and the public. So thank you, Dr. Tamala, for taking time this evening to share all the important information. And Pia, do you have any closing thoughts before we end this evening?
I really want to say a quick thank you to you, Dr. Malik. I learned a lot from listening to your presentation.
Oh, thank you. Not as many graphics on my end. Mine was a little bit more, straight from sort of straight information, not a lot of graphics. But no, I think that this information is important, and we need to be thinking beyond just the air we breathe and move to the next step.
Yeah.
And I'll just say in closing, thank you very much for doing this presentation. It was very helpful. We love having both of you present on the call. And we're open to any other suggestions on topics like this. This was Dr. Malik's suggestion, and it's certainly a valuable discussion. We look forward to more and more suggestions from the physician community on what topics matter to you.
Okay, well, thank you so much. And if there's nothing else, everyone have a great evening.